He was a morbidly obese surgeon destined for an operating table and an early death. Now he's a rebel MD who is fabulously fit and fighting to make America healthy again. This is Stay Off My Operating Table with Dr. Philip Ovadia.
And if I read this right, we are live. Welcome. It's the Stay Off My Operating Table podcast with Dr. Philip Ovadia. I'm your co-host, or his co-host, or somebody's co-host, Jack Heald. And we are joined today by nutritionist Amy Berger. I actually started this conversation late because I got deep into some of the stuff that she's written. And it'd probably be better if we get into it while we're recording rather than while I'm by myself. So Phil, set the table for us here, man.
Sure thing. So Amy is a nutritional badass, I will say. And, she's, again, one of the early people that I probably came across in the low-carb keto world. Her first book, which I'll now say, The Alzheimer's Antidote, is certainly one of the key texts that I think people should be reading. And then she's had two books since then. She's had The Stall Slayer, which is really just a great practical guide to, doing keto, and we'll get into a lot of that. And her most recent book, End Your Carb Confusion, again, just a powerhouse of a book when it comes to nutritional approaches. And I was fortunate, to meet Amy. I've now shared the stage at some conferences with her, and really excited to have this conversation and to bring her to our audience. So with that, Amy, why don't you fill in a little bit of the details about your background and kind of how you got to where you are today, and then we can dig into all of the great information you have around nutrition to share with us.
Yeah, thank you. I don't think anyone's ever called me a badass before, so that's that's the best introduction. I think for anyone who doesn't know who I am a low carb and keto oriented nutritionist and writer. And I got into low carb eating the way a lot of other people do. I used to be heavier, and I was doing what I thought were all the right things. I exercised a lot. I dutifully ate my whole grain cereal with my skim milk, and I put light margarine on my whole wheat bread and all that. And I could not lose weight no matter what I did. And I came into this from the Atkins diet. I actually read Dr. Atkins' New Diet Revolution. And this was over 20 years ago when I was in college. And I was not ready to make it my permanent way of life at that time. So anyone who's listening, if you have started and stopped and started and stopped, welcome to the club. I don't know anyone who learns about low carb or keto and just does it and that's it forever. They never stumble, they never go back. But I mean, I've been at this now a very long time, and I changed careers. I was fortunate in that I was not a nutritionist or dietitian who was conventionally trained, and then I had to kind of deprogram and relearn everything new. I actually went to graduate school for nutrition after I was already eating a low carb diet. So I was able to learn all of the, biochemistry and physiology in the context of already having experienced all the different things that low carb diets do. And long story short, now I am in private practice. I do see clients, but I also do a lot of writing. And I always say at this point, knowing what I know about low carb and keto diet, and you probably feel the same way, weight loss is one of the least impressive things that this can do. And if you're living with morbid obesity, I mean, yes, weight loss can change your life. I'm not trying to downplay that. But you could also literally be free of type 2 diabetes, be free of PCOS, get rid of heartburn, get rid of migraines, fatty liver. So weight loss happens to be like a little fringe perk benefit that happens on the side of all that other great stuff happening.
So you somewhere on one of your websites, I saw the phrase keto without the crazy. First of all, well done. Good title, good marketing. Secondly, expand on that. What do you mean keto without the crazy?
Yeah, the way that actually happened is I have a YouTube channel, and it just came out of my mouth one day, and I thought, oh my God, that's good. I'm going to have to keep that. And that has become my motto now and my trademark. But so like I said, I learned about this a long time ago when I was new to low carb. Twitter did not exist. Facebook, Reddit, YouTube, Instagram, Zoom, none of this even existed. And it was so much easier to start then, because all there was the Atkins book, there was the book Protein Power, and there was like one or two old school message boards
Protein
online.
Power. I
And
remember that.
sorry?
Protein Power. I remember that book.
That's
I
a
may
great
have even
book.
had that book.
Yeah, Mike and Mary Dan Eads. And so there was less information, but there was less misinformation. There was less conflicting and confusing information. And if I were new to keto now, I don't even know how I would possibly begin. I don't know where I would choose to get information. And so the keto without the crazy is like, here's how to do it, how and why. And here's how to do it without going bankrupt, spending a gazillion dollars on all kinds of gadgets and food. And, yes, you can do it without apps and spreadsheets and weighing every molecule of food you eat. And for the people that like that, great, do it. But for the people that want it without the crazy, that's what I'm here for.
Okay, so the crazy is a combination of the flood of information and the reality that there's a lot of it is misinformation. Have I got that about right?
Yeah, some of it's misinformation, but some of it's not necessarily misinformation. It's just not appropriate for certain situations, and I'm sure like Dr. Ovadia, you probably see this all the time. Certain things that are appropriate for one scenario are not for another. Like you can use a ketogenic diet for a lot of different things. The kind of diet that a child needs to prevent epileptic seizures is not necessarily the same kind of keto diet that works for weight loss in a postmenopausal woman. They look different. So it's like, it's not that anyone is overtly wrong. It just may not be appropriate depending on what somebody's trying to do.
Yeah.
I'd love to hear details, like examples. Like you gave two very different scenarios: a child, an epileptic child, and a postmenopausal woman. Come on, give us details here.
For kids, so the ketogenic diet was created for epilepsy. It's a diet that works to prevent seizures in at least some people. It doesn't work 100%, but and everybody's different. Even within the epilepsy world, some kids need to be not only very, very low carb, but they actually have to watch their protein intake, and they have to be more mindful of the ratio between their protein and fat and their carbs. Whereas somebody who's trying to lose weight, especially if like they are in that sort of menopausal, postmenopausal women, where that is the most difficult category for people to lose weight. And some of those women, we cannot have the ultra high fat. So when they talk about keto being a very high fat diet, that steers us wrong. What it really is very, very low carb. Most of us could benefit from more protein and kind of eating fat and enjoying fat, but not going crazy, not deliberately loading all our food up with, melted butter and cheese and oil. So both diets are low in carbs, but the fat is going to be different.
We had a steak and butter gal on several months ago, and she talked about when she flipped over from, I think she was a hardcore vegan, wasn't she,
Yep.
Phil?
Yes,
so.
it was.
She decided that was killing her or something, and so she started snacking on frozen sticks of butter. But granted, this is a woman in her 20s, so a little different. Okay.
Yeah, I mean, so what I love about your approach, Amy, is that practical, the way you just boil down, there is all the science, and you can get, way deep in the weeds, and you can be reading all these studies and, what the mechanisms of action are and all of this. But ultimately, for most people, they just want, what do I eat, and keep it simple. And the simpler you can keep it, the more successful I find that, it tends to be. And the more that it's able to resonate, and most importantly, the more that people are able to stick with it. Because I think one of the biggest issues I see out there, today in the nutritional world is that, people realize that, well, when they come to the realization that what they eat is a determinant of their health, that's sort of step number one. And then they start getting into it, and they're bombarded with all these different, camps of nutrition. And you have the vegans and the carnivores, and you have the hardcore keto people, versus more of the just the eat low carb, prioritize protein, type thing. And you have a good way of kind of breaking that down and helping people to understand that this doesn't need to be complicated.
Yeah, I appreciate that. I mean, that's definitely what I try to do, because it's like you said, it doesn't matter how effective something is if no one can actually do it, if no one can actually keep doing it for 10, 20, 50 years.
Yeah.
And I think it's like you said, on social media, there's all these people that love to debate the minutia of this one metabolic pathway and this one enzyme. But how much does that actually matter to the person that just wants to lose 50 pounds, to the person that just wants to get off their insulin for type 2 diabetes? They don't need to know that. And I see so many people who are so overwhelmed by thinking that they have to address so many different things at once that they give up, because it's like, I can forget it. This is impossible. Whereas for most people, just cutting the carbs is going to take them very far. And like, they might have to add in some other stuff over time, but the reduction in carbs is so powerful that they may not have to worry. Everybody now, you have to go in the infrared sauna, and you have to get, sunlight in your eyes first thing in the morning, and you have to fast, and you have to do all these things. And no, you don't. And if you love that, do it, but don't, people have been using this for hundreds of years. Carbohydrate restriction is not new. This is centuries old. We didn't need all this other stuff. Like, all we needed to do was cut the carbs.
Well, I when I was researching you, I like to make notes as questions come up. And one of the questions I was going to ask was, what's the fastest, simplest nutrition hack most people should adopt? But I think you just answered it. Cut the carbs.
Yeah.
Depending, would you expand on that? What does, let's get into more detail. What does cutting the carbs look like?
Yeah, that's a great question, because I was actually gonna say about Phil, one of the things that I really liked about, I read your book. One of the things that I really loved about your book was, you're not a keto zealot. You were very clear. Some people do well with paleo, which is not a super low carb diet, necessarily. Some people can eat just what, I don't like these terms, but what we would call real food or whole food. Not everybody needs an ultra strict keto diet. So when I say cut the carbs, it depends, because I think the sicker you are, the more severe your health situation is, the stricter an approach you need to get out of that and to start getting healthy again. So if you have, out of control type 2 diabetes, if you want to lose 100 pounds or 50 pounds, if you have metabolic syndrome, I think that the fastest and most effective way is to do a very low carb or keto diet. So that cutting carbs in that sense means not just the obvious sources of sugar, like not just the pastries and the sweets and the ice cream and the potato chips and stuff, but even some of the things we would consider a healthier, wholesome food, like beans, potatoes, sweet potatoes, fruit. There's some people who are so sensitive to the effects of carbohydrate that they have to cut all of that. But some people aren't. Some people can have, I hate to give numbers, but 50, 100 grams of carbs a day, and they're fine. But some people, in order to really make a dent in those metabolic problems, I think you need to be very low, but maybe not forever. Some people, they go on a very low carb keto diet, they lose the weight, all the health problems go away, and they can gradually reintroduce small amounts of sugar and starch, and they're fine. But they probably can't go back to eating huge amounts of that.
So it occurs to me that there's probably two categories of people who would benefit from this. I'm sorry, I should clarify. Of unwell people. There's the people who have serious problems and know it. And then there's the people who have serious problems and aren't aware of it. And I'm thinking of myself 17 years ago. I had what eventually led me into nutrition as a way to be healthy was severe heartburn. And it was certainly a royal pain in the neck. But if you'd have said to me, "Oh, Jack, you're deeply unhealthy," I would have said, "Nah, I need more Tums than most people." So that's just a way of setting up the question. What are some fairly common symptoms that people walk around all day long thinking is normal or mildly irritating, that is actually, hey, you've got a problem and a low carb approach will help?
I could not love that question more. Oh my goodness, because no, I really do think there's millions of people, like you said, who know they're sick. They have diabetes, they have prediabetes, they have PCOS or something. And then there's this whole other portion of the population that most of their blood work, not all of it, most of it looks okay. They don't have any major problems, but they have all these like everyday nagging little things that they don't realize are actually a big red flag.
Right.
It's just so normal, and they've had them for so long that they don't even think about them anymore. So one of those would be, like you said, heartburn. Believe it or not, skin tags. That's a big one that's surprising. Not always.
Really?
Some people that have multiple skin tags, that's a sign of too much insulin, because insulin is a growth signal, and it's literally you're growing too much skin.
Wow.
Men with BPH, enlarged prostate gland, could possibly come from chronically high insulin. Migraines, hypoglycemia, which we were just at the Symposium for Metabolic Health in San Diego, and Dr. Brian Lenskis gave a great talk on the use of CGMs, the continuous glucose monitors. And he and his patients had discovered that he had a patient who was having what she thought were panic attacks. Turns out they're not actually panic attacks. It was hypoglycemia manifesting as that. So I think that's a big one. I think irritability, road rage I think that's also unrecognized hypoglycemia. So many others, I can't.
Well, I think you've given us a good list here.
Definitely.
Brain fog, any of these
brain,
things can benefit from low carb.
The brain fog, the being tired, the joints that hurt, that everyone just attributes to old age. And, most of these things are related to what we're eating.
Yeah.
All right. So,
what, I was going to say, the people that you work with, what are some of the common, I always hate to say, things they're doing wrong, but, what are some of the common missteps that you find that people make, when they start to sort of dip their toe into this water and they say, okay, I realize I'm unhealthy, it's because of what I'm eating, I'm going to do this low carb keto thing. And, what are some of and then, it doesn't work. And hopefully, they're kind of persistent enough that they find someone to work with on this. What are those common sort of problems that you see people have that can be corrected to make it, work better for them?
Yeah, the two biggest. So you mentioned my book, The Stall Slayer. I basically wrote a whole book about things that get in the way of fat loss on low carb. The two biggest are too many carbs, too much carbohydrate, and the second is too much fat. And with too many carbs, and I was very, very lucky to have, I still work with him, with Dr. Eric Westman, who's been in this, it's about as long as anybody. He did some of the earliest research in low carb and keto diets. And his method has always been total carbohydrate, not net carbs. So in other words, you don't subtract the fiber or the sugar alcohols. So that doesn't leave room for all these newfangled, the keto bars and the keto cereal and the keto ice cream. That gets in the way for a lot of people, those excess carbs. It's not like they're eating rice and noodles, but they're eating all these keto products that they don't realize they're actually having way more carbs than they realize. And then the other big one is the fat. Like I mentioned earlier, it really kind of irks me when everybody calls keto a high fat diet. It's not. What it really is very low carb, or depending on the situation, right? But a lot of people, the excess fat, when they think they have to hit a fat macro, or that their diet is supposed to be 80% fat or something, so they're adding extra fat even when they're not hungry for it, they don't need it. They're like melting oil and butter on everything because they think they're supposed to. And that very often gets in the way, especially of fat loss.
Are there signs and symptoms that you're getting insufficient fat? Like the other side of the problem that you just described. Not that you're getting too much, but that you're not getting enough.
Are you talking about on a low carb diet specifically,
Right.
or
If you're
just
on a
in
low
general?
carb diet, but what are there any signs that you're really being way too strict with your fat?
You'd probably be hungrier. I mean, fat does help satisfy us and keep us going between meals. I think this would be true of any diet, but if you go long enough without enough fat, you'll start to have like dry skin, and your hair might start to get kind of dry and not look so shiny and nice. But I most of it is probably going to be the hunger. You're just going to be hungry because protein will fill you up, but you can't live on protein alone. I'm trying to think though, Phil, do you know of anything else, like specifically? Nothing's coming to me at the moment, but
yeah, well, I was just going to say lack of energy and the tiredness, is
yeah.
the other thing that I oftentimes see with people. And this is something that I do encounter because, being in the heart disease world, of course, everyone has had it, just hammered into their brains that, low fat is the way to prevent heart disease. And despite, the fact that we know that is just wrong. We have all the data we need at this point, but people have a hard time getting past that. And so oftentimes, when I'm working with them, I'm saying, it's the carbs and the sugar and you got to cut that. And then they still kind of stay low fat. And now they're kind of low carb, low fat, and that's probably the biggest thing I see is that then they're just like, I'm tired all the time. And, I don't have the energy and they don't see the benefits, basically you're putting your body into starvation at that point, oftentimes. And so your body, fights it and you don't lose the weight, and you don't get, the mental health benefits and all the other benefits that we see from, doing a low carb diet that's better formulated.
Yeah, no, I agree. I totally forget. That's like, I knew there's big ones that I'm forgetting. The energy level, the fatigue, and yeah.
Yeah, you got to get your energy from somewhere ultimately. So I think that's important. So talk a little bit, one of the reasons I said you're a nutritional badass is because, you learned a lot of this stuff, you started doing it, and then you decided to go back and get your degree, like you said. And I think you kind of knew going into it that you were going to be fighting the battle, you're going to be having to answer the questions on the test the way that you might not, the way that is not exactly true. But tell us what that was like going through your nutritional education, having already, learned so much and knew so much about, keto and low carb.
I was actually pretty fortunate. I chose the specific program I chose because I knew they wouldn't be conventional. They wouldn't teach me like the food pyramid and that kind of thing. And it's a fully accredited program. It was a real university, but I just knew that that program would be not quite as conventional. And biochemistry is biochemistry, right? Anatomy is anatomy. Those don't change. So I loved those classes because I knew a little bit about how low carb worked, but once I really started learning the deep science, I was able to say, oh, that's why insulin does what it does. Oh, that's why this amino acid does what it does. That's why low carb does what it does. Like at the molecular level, learning about the Krebs cycle or fatty acid oxidation. I mean, that was amazing. I was very lucky. Like, we didn't get taught that, you have to eat this many servings of grain, or so I'm because I'm not a dietitian, I'm not an RD, my training, I mean, they of course learn all the science as well, but I think they learn a little more of that conventional nutrition teaching. Most of my professors, now we certainly didn't learn keto, but most of my professors knew, like, we're probably all eating a bit too much carbohydrate. And there was one of the biochemistry professors he knew, I guess he was not opposed to saturated fat, because he's like, the chemistry of this, I don't understand how this would be harmful. So I feel really fortunate. I was able, like, I didn't have to unlearn things that I was taught. I have a lot of RD friends and other nutritionist friends who did go to more conventional programs, and they learned about this on their own, and they sort of had to like deprogram their brain and learn all this new stuff. But it's even going through the same science classes, like my fellow students could come away from it with very different interpretations, right? Okay, if this is how this pathway works, then what should we eat? We could think very differently about it. But I feel fortunate that I didn't have to unlearn a lot.
You're rare. We have guest after guest after guest trained as professional healthcare providers who tell us stories about all this stuff they had to, that was just wrong. It was just completely wrong. So let's talk about it. It was Bridgeport. That was the name of the university?
Yes. Uh-huh.
All right. So for those of you listening and wondering where the heck did Amy get a decent nutrition education, Bridgeport, look it up.
University of Bridgeport.
University of Bridgeport. Hey, I want to ask about Alzheimer's. It wasn't very long ago that it was revealed that the root cause of Alzheimer's, as had been reported, 15, 18 years ago, that the researcher basically just made up his data. And we've spent literally billions and billions and billions of dollars chasing a joke. It was worse than a joke. People died and money was spent on things that was never going to happen. Talk about Alzheimer's, what you have learned, its relation to nutrition. I read that you had published 3 books, but I didn't realize the Alzheimer's one was the first. So I'd like to hear, first of all, why that was the first one, and then kind of give us headlines.
Yeah, that book, The Alzheimer's Antidote, it is my first book. And the reason it was the first is that was actually my graduate thesis. It was a much, much smaller, I did a literature review on Alzheimer's disease. And after I graduated, I felt like it was really potentially life-changing information. I'm like, this is going to sit on my professor's computer. No one's ever going to know anything about this. So I expanded it into, it was a PDF ebook that I sold myself, and a publisher found it and offered me a book deal. I will never be that lucky ever again. So then I expanded it that much more into the book it is now. And for anyone who happens to be brand new to this concept, like why on earth would a nutritionist, let alone a low carb nutritionist, have anything to say about Alzheimer's? They routinely now call Alzheimer's disease type 3 diabetes or diabetes of the brain. And where this comes from is the main problem in the brain of somebody with Alzheimer's is that neurons, for whatever reason, we don't know why, they have lost the ability to take up and metabolize glucose. So they're not getting fuel. You think of it as a fuel shortage or like an energy crisis in the brain. So of course, these cells are kind of starving. Of course, you're going to have memory loss. Of course, you're going to have, personality changes and all the things we see. So the most promising, most encouraging thing that we know about Alzheimer's right now is that even though the brain is not taking up and using glucose properly, it still takes up and uses ketones. So if we can provide maybe this other type of fuel to these otherwise starving cells, maybe we can improve the cognitive function. And the research says that's true. Maybe not 100% in everybody, but it is the most promising thing going on right now, I think, in Alzheimer's.
I want to make sure I understand what is currently diagnosed as Alzheimer's is in the brain cells, essentially the same thing that's going on in our bodies with insulin resistance, inability to make use of need a ton of insulin in order to get enough glucose into the cells, which this is the idiot layman trying to explain diabetes. So the brain that's the same kind of situation in the brain, but because our cells can also use ketones for energy rather than glycogen, if you flip your system over into ketosis, you're now providing your brain the alternate fuel that probably uses a different pathway than glycogen. I don't know. Am I roughly remotely in the same?
No, that's basically it. But the insulin and glucose have kind of a different relationship in the brain. You actually don't need insulin to get glucose into the brain, but insulin does other things in the brain. And if there's not enough so the Alzheimer's brain actually it looks like there's less insulin in the brain. So whatever insulin is doing is not happening. And the glucose, that's related though, that the glucose is not being taken up properly, but that's not because of insulin in the brain, because glucose would get in the brain anyway. But I can say that type 2 diabetes and chronically high insulin, even if you don't have diabetes, and I cannot emphasize this enough, even if you don't have diabetes, so if your blood sugar is normal, if you have chronically high insulin, that is a huge risk factor for Alzheimer's. Huge.
Yeah.
Wow.
And, it also plays into, we had Christopher Palmer on not too long ago, and of course, all of the work that he's doing and so many others are doing out there, discovering, the effects of, high sugar, high insulin on the brain in many different scenarios. Alzheimer's is certainly one of them, but, when we start to look at some of these mental health issues, and we see that same picture emerges. And it's clear at this point that, high sugar is not good for the brain. I think we can certainly say that.
Yeah, everybody's heard of metabolic syndrome, which basically comes from high insulin. The connections now between metabolic syndrome or chronically high insulin Alzheimer's and the precursor mild cognitive impairment, those associations are so strong. They have the phrase metabolic cognitive syndrome. So they're not unrelated. And it's with with cardiovascular disease and diabetes and obesity, we don't even question that those are driven by diet and lifestyle. People might have different opinions as to which diet is causing it or which diet's the best solution, but nobody pretends like diet and lifestyle aren't the major factors there. But when it comes to the brain, whether it's mental health, like Dr. Palmer and Dr. Georgia Ede talk about, or whether it's cognitive function, we dismiss even the possibility that these could also be diet and lifestyle things. And I think, of course, with mental health, there's so many other things that go into it, trauma, so many other lifestyle, circumstances can affect mental health, of course, but let's not ignore the possibility of how much of it is driven by diet. Just like all the other things that go wrong in the body, things are going to go wrong in the brain too.
It sounds like the message there really is, I'm thinking about, when somebody's knows they're unhealthy and is trying to get healthy with their body, oftentimes they get stymied emotionally or psychologically or mentally, whatever. There's stuff going on upstairs that just they have trouble pushing through. It sounds like the message is, hey, eating this way will also help you just have better cognition, you'll think better, you'll emotionally be a little more stable. Am I overstating that?
No, I don't think you are. I think what we eat has a huge influence on our mood, on our behavior, but I don't want to dismiss the other factors that contribute. It's not all diet, but I think you're absolutely right. Diet plays a huge role.
All right. Well, if you don't mind, I want to turn the corner again. Hypothyroidism, thyroid, and depression. I'm not rare in that I have had a number of people in my life who have dealt with some form of thyroid dysfunction. And it just appears from the outside to be hell. What I haven't heard is a connection between thyroid and depression. I just love to enlighten us. Tell us what you've learned about thyroid problems and depression. And
yeah,
keto.
I'm not a medical doctor, so it's not just my opinion. It's my opinion. It is my own personal experience, and it's my reading of the published literature. My next book, the book I'm writing right now, is about thyroid. And I think the chapter on depression is probably the second longest chapter in the book, second only to the chapter on weight. I see so many clients who are on antidepressants and on statin drugs and on all kinds of other medicines, when what I think they really need is thyroid medicine. So when your thyroid hormones are not, if they're low and they're not where they need to be, your whole body slows down. This is what you have: constipation, even the muscle contractions in your colon slow down. You lose your hair, your metabolic rates, everything slows down. This is why you gain weight, or you have a really hard time losing weight. And the depression, and for some people, they may not think of it as depression. In a lot of people, it manifests as apathy, kind of a flat line. They're not especially low, but they just kind of make do every day. It's like you said, it can be hell. It can be absolutely debilitating. It can rob you of relationships. It can rob you of self-esteem, of trying to go for promotions at work, because you just feel so awful all the time. And if I seem a little passionate about it and a little like my heart is breaking right now, it's because I am, and it is this. And the worst part is that so many people, and it's women are affected far more than men. Men can have thyroid problems, but it's about a 9-to-1 ratio that women are affected way more. And they can go for years, sometimes decades, without being properly diagnosed. And some of that is because the reference ranges that are used are not appropriate, but it's you can just lose years and years of life to feeling miserable because of undiagnosis.
Is it, go ahead, Phil.
No, I was just going to jump in and say, even once they are diagnosed with a thyroid problem, it's oftentimes not, I guess the root causes of that thyroid problem aren't, investigated. And so oftentimes it ends up getting treated in an ineffective manner because we're not really addressing what led to the thyroid problems in the first place.
That is definitely true. And it's also true, I think it's not always easy to identify the root cause. So in the meantime, if you have to take thyroid medicine, I think let's take advantage of medical technology where we can. I mean, not every drug is bad for us. Unfortunately, the most commonly prescribed thyroid medicine, the T4 only, the levothyroxine, does not work for a lot of people. They can take it and they still feel awful. They still have all their same signs and symptoms because that T4 is not being converted into the T3, which is the one that actually has the biological effect. And so some people do really, really well on the levothyroxine, but a lot of people don't. And I see this all the time. I just see it all the time.
The daughter of a close friend struggled with serious thyroid issues. First, several sets of blood tests and whatnot. Her numbers came back within range, and nothing ever changed for her. She finally got a hold of a physician who seemed to have some understanding of it, and he ran much more detailed tests and was able to point out, okay, this is normal. This is way the heck out of what normal is, but we don't even know what normal might be for you. And we can objectively say that these numbers are just completely wrong. I don't want to get into a doctoral dissertation here, but can you give us kind of some headlines about what people should be getting tested for if thyroid dysfunction is suspected?
Yeah, again, my book, well, I want to say will go into great detail once it's out. The problem is that when you ask for a thyroid test, doctors usually, and when I say doctors, that also includes nurse practitioners, PAs, whoever may be ordering the test, because I have a co-author on the book and she's a nurse practitioner. She would kill me if I left out the importance of these other medical professionals. They will only order 1 or 2 tests, and they test the TSH. Sometimes they test the T4. And like you were saying with this person, it is not uncommon for those things that they test to be normal, but there's 4 or 5 other hormones that should, in my opinion, should be included in they call it a comprehensive thyroid panel. And where if those 1 or 2 are normal, if you dig deeper, you will see that there may be 1 or 2 others, specifically the free T3 that's in the toilet. And the other issue, you brought up the great issue, that even if you fall within the normal range, that might not be, normal does not mean optimal. So if you are at the very bottom of the range, you might feel like a new person if you were closer to the midpoint or higher, but still within the normal range. So just because you're normal doesn't mean you're going to feel well. I really, really wish that more doctors would go by the symptoms versus the numbers. And this, we see this even within the other metabolic things you would measure for something like diabetes or metabolic syndrome. Most labs will tell you that a fasting insulin of 20 or 25 is normal, right? That's crazy. I think those of us in the low carb world think that's kind of nuts. We don't like to see it that high. So the art of medicine, I think the art of doctoring needs to be factored in. You can't just look and you see that they fall within the range. Great. Who cares where they fall within any particular range when they're sitting right in front of you and they're telling you, I'm depressed, I'm constipated, my hair is falling out, I'm cold, I haven't had sex in 9 months because I have no sex drive, and all of these things. How can you ignore that and say, well, your numbers are normal, see you next time?
Well, you're talking to the healthcare practitioner, and I'm talking from the standpoint of the person who's going to be sitting in the chair. What do you say to those people to say to their healthcare provider, hey, I need you to check for, is it what you called it, a comprehensive thyroid panel?
You have to ask, you have to ask for the comprehensive thyroid panel. And then even if your doctor or nurse practitioner is willing to order it, you have to confirm with the lab when you get the blood drawn, because I've had clients who say, oh, my doctor said they ordered the full panel, but then when they get the results back, there's only that standard 1 or 2 things. But that, I don't know if I should get into detail. There's a couple, so a comprehensive panel would include...
Here's what I'm after. People are listening to this and they're starting to recognize themselves. Give us enough information to at least send them in the right direction to get the details they need.
Well, I have a video that we could maybe link to, or if you go to YouTube and you search Amy Berger thyroid, a few videos should come up. But I think, and I don't know if we could maybe link to it if you do show notes, but we'll put some links then. But ask your doctor for a comprehensive thyroid panel. If your doctor does not want to do it, some of them won't. If you live in any state in the US except New York, New Jersey, and Rhode Island, except for those 3, you can do this testing on your own without a doctor. You can go to directlabs.com or ownyourlabs.com, or I think it's order a test. There's a lot of different testing websites where you can order your own labs without a doctor. And then the issue then would be, you still need someone to help you interpret them and to prescribe you the medication if you need some. So that may still be a battle, but the first step is to do the testing. And yeah, if I am talking to anyone out there who has lots of symptoms of hypothyroidism, but you've been told for years you're normal, there is a good chance you are not normal. You need this full testing panel. You cannot just go by the normal tests. And if you are taking the T4 the most common brand name in the US is Synthroid, but it's levothyroxine. The most common brand is Synthroid. If you've been taking Synthroid forever and you still feel like garbage, there is help for you. You need the more advanced testing because your T3 is probably in the basement.
Now, this is the point ordinarily where I would love to get into the chemistry of free T3 and free T4 and all of that kind of stuff, but that's for another time. We have discovered, well, we being me, mainly through Dr. Ovadia, that we've been lied to or misled. Let's say misled. We've been misled about the role of cholesterol in heart disease, the role of serotonin in depression, the root cause of Alzheimer's, about whether or not diabetes is reversible, for decades. And we've made choices based on that misinformation. Is there another giant glaring realm of misinformation as it relates to health and nutrition that you'd like to address?
Those are the biggest ones. I mean, the cholesterol thing, the saturated fat thing. If I will lump red meat in with the saturated fat, but if I had to choose another one, it's protein, because I think women especially have been sort of brainwashed over the years that our protein portions should be about the size of the palm of our hand or a deck of cards. Women's magazines have been telling this for 40 years, and there is not one shred of scientific evidence to back that up. There is nothing about the human digestive system that says we should eat that much in a meal. And I think it's done women a huge disservice because they're afraid to eat a substantial piece of protein. And so they're still hungry, but they're afraid of fat. So they'll have a granola bar, or they'll have some cereal, or they'll have a rice cake. And they wonder why they're hitting the ice cream at midnight, because they're starving and they're still hungry. Or we think it's unladylike to eat a big piece of steak. I don't think it's unfeminine. Maybe I'm not a feminine woman. I don't know, but it's this, I think the protein, and you could say the same is true of men, but I just don't think men have not been scared into eating very small amounts of protein the way women have.
So
And I think,
there's a social pressure on women that is
Yes.
not on men.
yes.
You know, that's hardly science, but that may be the most powerful thing we've heard today. Ladies, get over it.
Eat more protein.
Oh my.
And yeah, I think
Good.
not only will you be less hungry, you won't need to snack between meals. Forget this little 3 ounce, like eat. And you may even find that your moods are more stable, especially if you cut the carbs and sort of replace some of that with protein. Your blood sugar is going to be more stable, your mood. I think that's a huge missing piece for a lot. And women who are, all their lives, they've had weak, soft, brittle nails, and they buy all these special lotions and potions to put on the nails. Double your protein intake and see what happens to your nails and hair.
Is the protein intake recommendation for women basically the same as it is for men? 1 gram of protein for every kilogram of body weight?
So yes,
I don't mean to open a
that's-
can of worms.
Well, yeah, I understand that, the official recommendation is more like, the RDA, the recommended daily allowance is 0.4 grams per kilogram of body weight. So that's the official recommendation. I think the 1 gram per pound that so many of us, here in the low carb world, talk about. I don't see that as being different for women than for men.
Yeah, I don't think it is. I think, but like you
So
said,
it's a gram per pound.
Again, that's what I recommend. That's
Okay,
what many
okay.
others recommend.
And the
but-
official RDA is 0.4 grams per kilo of body weight?
it's 0.8 grams per kilogram,
Yeah,
but
0.8, right?
that,
0.4
Yeah,
per
but
pound.
that's still just crazy.
but the problem with that is
I'm no
that was never
nutritionist, and I know
intended.
that's nuts.
Yeah, but that was not intended as the ideal or optimal amount. That is the minimum amount to not waste away. And so I think for people, I agree with the 1 gram per pound, but I want to stress, I agree with Dr. Ted Naiman, who 1 gram per pound of your desired weight. So let's say you weigh 300 pounds, but you want to be 205. Don't eat 300, aim. But I also, this is when I say keto without the crazy, or just nutrition without the crazy. You don't have to hit that exact number every single day. It's okay to be lower sometimes, higher sometimes. That's a general ballpark. And then the other thing, your listeners and viewers probably know this, but in case they don't, because it amazes me how many people don't know this. If we say eat 100 grams of protein a day, that is not 100 grams of a protein food on a food scale. 100 grams of protein is different from 100 grams by weight of chicken or fish or beef. The rule of thumb, I don't want to confuse people. The rule of thumb is each ounce of a protein food, like beef or pork or seafood, each ounce contains approximately 7 grams of protein. So a 3 ounce piece of fish or chicken would be about 20, 21 grams, general ballpark. So if we say to eat a certain number of grams of protein, you cannot assess that by weighing the food on a scale. It's a different measurement.
It's a calculation though. So
Yeah.
an ounce of protein
Since-
equals
since-
7 grams of 7
Ish. Yeah.
grams of protein. Okay.
I think since you and I, like to keep it simple, Amy, the general rule is eat more protein and eat less carbs. And, for the vast majority of people, that's all you need to pay attention to, and you're gonna end up in a better place.
Yes.
All right. I want to say one last thing. I was looking at your website and I'm scrolling down in the blog and it says the Stall Slayer. And thank you for illuminating us about what that actually meant, because I thought it was a bathroom serial killer, to be honest. She writes murder fiction. Okay. Amy, it's been a pleasure. This has been, for me as a non-medical professional, this has been just packed with practical things to know and to be able to implement. I have one last question I want to ask you. Is there a celebrity, a nutrition celebrity you'd like to duct tape?
Duct tape how? So they never say
across
anything
their
again,
mouth,
or
tie them to
oh,
a chair and beat them. I don't know.
ooh, it would be hard to pick one. Again, and I don't want to name names. I think everybody is coming from a good place. Everybody wants to help. Everybody means well. We just might disagree a lot over the best way to accomplish good health.
Okay, well, I gave you a chance there. All right, Phil.
Better for me to not name names.
We'll try and keep our guests mostly out of trouble.
Well,
so Amy, just tell people a little bit about how you work with people, how they can find you.
Yeah, thank you. My main website and blog is tuitnutrition.com, TUIT nutrition.com. The website's in massive need of overhaul, but I do have private consultations, but you're better off going to stallslayer.com and clicking on work with me for the consultation. So stallslayer.com. And I also do I help a company called Adapt Your Life do online courses about keto, and that's at adaptyourlifeacademy.com. And you can follow me on Twitter at tuitnutrition, and I have a YouTube channel, which I just changed the name, so it goes by my name now. It's Amy Berger, and that's Berger, and it's Keto Without the Crazy. So all my videos are there, and yeah, I do, like I said, I do the consultations, but I also think if you're brand new to this, check out the book that I wrote with Dr. Westman called End Your Carb Confusion. That's the book I would want to have if I was brand new to all of this now. The simple, straightforward way to do it.
good stuff. All right. Well, for our listeners, as always, we'll make sure that this contact information shows up in the show notes. So you'll just be able to click and get there. Phil, anything you want to wrap before we wrap it up?
No, just another great week, another great conversation. Really, want to thank the audience because the show has been growing significantly, and we're just so happy that we're getting this information to so many people that need to hear it.
Yeah, and Phil, before we close, I want to reiterate that I appreciate it is so fabulous not only to have more medical doctors who understand this, but a cardiac surgeon, for goodness sake. I mean, that's incredible to have a heart surgeon who says it's okay to eat butter and it's okay to eat red meat, but also that you, like I said, in your book, Stay Off My Operating Table, that you were very clear that maybe not everyone needs keto. As much as I love keto and I know how powerful it is, not everybody needs to go that far. Some people can just sort of clean up their diet. So I appreciate you, respecting that different people need different things.
Well, I guess we're going to have to put an end to the love fest, but yeah, it's been great. Amy, it's a pleasure to meet you. A lot of fun to talk to you. I personally have learned some things I've gotten some questions answered today that I've had for a long time that I didn't know I had until I started reading about your stuff. So I want to thank you for being here. Well, this is the Stay Off My Operating Table podcast with Dr. Philip Ovadia. You can follow Dr. O on Twitter at iFixHearts. Go to his website, ifixhearts.co. Take a metabolic health quiz just to find out exactly what you may or may not need to do. And you can also reach his website at ovadiahearthealth.com. Until next time, I'm Jack Heald. Thanks for joining us. America is fat and sick and tired. 88% of Americans are metabolically unhealthy and at risk of a sudden heart attack. Are you one of them? Go to ifixhearts.co and take Dr. Ovadia's metabolic health quiz. Learn specific steps you can take to reclaim your health, reduce your risk of heart attack, and stay off Dr. Ovadia's operating table.